pelvic bones is the first title that today I'm going to talk about. So today we are going to talk about the pelvic bone. As you know, in this picture, you are going to look at the pelvic bones. Which bones are going to form the pelvic cavity? If you notice, you can find two right and left hip bone, sacrum, and the coccyx. So at the first, we are going to speak about the pelvic bone. The pelvic bone consists of right and left hip bone, sacrum, and the coccyx. But sometimes we are going to speak about the pelvic girdle. The pelvic girdle consists of the two hip bone and the sacrum. Because the sacrum is the only bone that it is going to transfer the power, the weight to the lower limb, and the coccyx is not responsible. So, in pelvic bone, yes, you should speak and you should think about the coccyx. But about the pelvic girdle, no. Only you should talk and you should think about the right and left hip bone and the sacrum. If you look at the right and left hip bone anteriorly, they are going to make a joint that we call symphysis pubis. You know the symphysis pubis. You pass the lower limb, and also you pass and read about the muscle in anterior wall of the abdomen. Yes? You pass the digestive system.
Yes.
Yes?
No, still.
We took the anatomy of digestive system.
When?
Yes. A week ago, I think.
So you know something about the pelvic bone. Now look at here, these two right and left hip bone posteriorly are far from each other, and this stage is going to be made joint with the sacrum. So in each side of the pelvic bone, we have the sacroiliac joint. This sacroiliac joint in both sides is a kind of synovial joint. And you know that the synovial joint has which feature? The anteriorly right and left hip bone are going to make joint and make the symphysis pubis. Which kind of the joint it is? Cartilaginous. So it is a kind of cartilaginous joint. But the sacroiliac is a kind of synovial joint. Do you remember that?
Yes.
Excuse me? Which joint is cartilaginous?
The symphysis pubis is a kind of cartilaginous joint. You know the cartilaginous joint is a kind of joint is you have movement, but the movement is limited. The synovial joint is a kind of joint that they have move, they are going to move Now, if I notice to this picture, I am able to show you two cavities. One of the cavities is here, and one of the cavities will be here. You know, the superior aperture, the inlet, the superior opening of the pelvic is going to be found here. Do you remember the lower name? And here also is another part of the pelvic cavity. What we can call here is the large or big pelvic cavity, and here is the small pelvic cavity. The small pelvic cavity we can call true pelvic cavity, and the large and the big pelvic cavity is the false pelvic cavity. Why here is the false pelvic cavity and here is the true pelvic cavity? What do you think? What's the reason? You know the main organ inside of the pelvic cavity, such as the rectum, such as the uterus in woman, such as the ovary, such as the urinary bladder in the man, such as the prostate. All of these organs are going to occupy and they are going to be found inside of the small pelvic cavity. So we can call true pelvic cavity. But here, really, you are going to find some of the organs that belong to the abdominal cavity, such as the septum, such as the colon, okay? These structures are going to be found here, and they are going to be supported by this part of the bones. So here, we call the big, large, or false pelvic cavity. Do you get that? So we have two pelvic cavity, a small and large pelvic cavity. The small, another name we can call the true pelvic cavity, because the main organ that belong to the pelvic cavity are going to be found inside of the small pelvic cavity. And here, superior, upper to this inlet, upper superior to this superior aperture, this side of the pelvic cavity we call the large pelvic cavity, because the abdominal organ are going to be supported and they are going to be found in this part of the pelvic cavity. Okay? Now, we are going to speak and introduce to you in detail about each of these bones. In this picture, you are going to look at to the right and left hip bone. Posteriorly, the right and left hip bone are far from each other. And as I explained for you, which structure, which bones is going to make joint here sacrum. And in these two pictures, you are going to look at to the pelvic cavity anteriorly and superiorly. So the symphysis pubis are visible, the sacroiliac joint are visible, and you know each hip bone consists of three parts. Each hip bone consists of three parts. These three parts, the superior and the largest part we call ilium. This part of the bone we call ilium, the superior portion of the hip bone. And it is the largest segment. Inferiorly and anteriorly with the orange color, we are going to show you a small portion of the hip bone that we call pubis. And inferiorly and posteriorly with the another color, we are going to show you the ischium. Ischium, pubis, and the ilium are going to attach to each other, are going to adhere to each other at the acetabular. What is the acetabular? Acetabular is a fossa. At the floor of this fossa, you are going to find a T or Y form junction. This Y form or T form is going to show you that the pubis, ischium, and ilium are going to attach to each other. They are not going to make joint here. They are going to attach to each other, to fuse to each other. Okay? Now at the first, this junction is a fibrous tissue, and with the age, with the time, it is going to change to the bones. So at the first, in the baby, you are able to separate these three parts of the hip bone very easily from each other. But when they are going to get larger, when they are going to get older, this junction is going to change to their bones, and you are not able easily to separate these three parts of the hip bone from each other. Okay? Now look at the acetabular. It is a cup-shaped fossa. Inferiorly, I am able to show you a notch. Normally, when you are going to think about the acetabular, you should remember that this acetabular notch should remain and should keep in your hand inferior. Now look at the acetabular. In the acetabular, in the central part, here is the non-articular space, and the peripheral part is the articular space. This articular space is such as the C4, such as the U, okay? Such as the C4, such as this, or such as this. This part, this peripheral part of the acetabular, we call lunate surface. We call lunate surface. And the central part, that this is the non-articular area, we can call the acetabular fossa. We can call acetabular fossa. Now in the boundaries between the male and the female, this lunate surface in the male sex is larger, is wider, and this central part of the acetabular is a part that the head of the femur and the short ligament of head of the femur is going to attach to this part. Okay? So if you remember the head of the femur, in the head of the femur, you have a short and very small ligament that we call the ligament of head of the femur. And you know, a very narrow, a very small and very narrow artery is passing inside of this ligament. This narrow artery is responsible to supply the head of the femur. If you have any problem for this ligament, means you have problem for this artery. So when the artery cut, or when the artery close, so the head of the femur is going to get necrosis. Okay? This ligament is going to attach to the acetabular fossa, to the central part. It is non-articular area. And the head of the femur has articular surface. The articular surface is going to get adjacent to this peripheral part of the acetabular. The acetabular fossa is very small. To be able to get larger, around the acetabulum, you can find the labrum. Have you ever heard about the labrum? Labrum is a fibrocartilage structure. It is a circle, and in the central you have a foramen. This acetabulum is going to get deeper by this labrum. Labrum is going to be found around the acetabulum fossa, and it is going to get deeper the acetabulum fossa. And this labrum is going to help to support from the head of the femur. Never is we have dislocation. Always this labrum is going to help to the head of the femur to be inside of the acetabulum completely. And the dislocation is going to prevent by this labrum. Okay? Do you remember the scapula, the glenoid fossa?
Yes.
Around the glenoid fossa also you can find the labrum. What's the function of this labrum in the acetabulum, in the scapula? It is the same function. It is going to get larger and deeper the glenoid fossa, so it is going to support from the shoulder joint. This labrum also around the acetabular is going to help to the other hip joint, and it is going to prevent the dislocation. Now look at to the ilium. Ilium is going to form for us the superior border, the superior margin of the hip bone. What's the spatial name of the superior border? Iliac crest. So superior border of the hip bone completely is going to be formed by the ilium. What about the anterior border? If you look at to the anterior border, two segments of the hip bone are going to participate. Which bones? Ilium and the pubis. What about the inferior border? Pubis and ischium. What about the posterior border? Ilium and ischium. Now, if I change the picture, it is the same that I showed you in the previous slide. But here you are not able to find the spatial and the different color. You should know that the superior portion and the large portion is ilium, inferior and anterior segment we call pubis, inferior and posterior segment we call ischium. Exactly, inferior to the acetabulum, we are able to find a foramen. What's the name of this foramen? Obturator foramen. And we know normally obturator foramen is going to be covered by the obturator membrane. And always a small area, a small foramen remain here for passing of the neurovascular structure. The neurovascular structure are passing from this foramen. The name of this membrane is obturator membrane. We can remember that always the obturator foramen, the position is inferior to the acetabulum. Now you are in the exam, and I'm going to ask you about some question about the hip bone, such as this. Which of the or all of the following items are correct about the hip bone except? In hip bone, the acetabulum position is superior to the obturator foramen. Yes.
Cool.
The obturator foramen is inferior to the acetabulum. Yes. The acetabular notch is going to be found superior to the acetabulum foramen. No, it is the incorrect. Okay? The statement. So the acetabular notch that it is going to be complete by a transverse ligament always is going to be found inferior to the acetabulum fossa. Now, look at to the posterior border. In posterior border of the hip bone, we are able to show you two notches. One of them we call greater sciatic notch, and one of them we call lesser sciatic notch. Lesser sciatic notch is going to be found exactly inferior to ischial spine. The greater sciatic notch exactly is going to be found inferior to posterior, inferior iliac spine. For the ilium, please notice to the ilium, you know something that I am going to speak today again. But it is, I should speak because I want to remember everything. Look at to the ilium. Ilium is here, superior to my hand. Ilium consists of the anterior superior iliac spine, the anterior inferior iliac spine. Posteriorly, the superior posterior iliac spine, the posterior inferior iliac spine. So exactly, inferior to posterior inferior iliac spine, I am able to show you the greater sciatic notch. This greater sciatic notch, superior arm, and the inferior arm proximal arm completely is going to be formed by the ilium, but the inferior arm in the distal part belong to the ischium. The ischial spine belong to the ischium. Now in the exam, I am not going to ask you that the ischial spine belong to which part of the bone, because you know, it is clear. But it is possible, I ask you, for example, the obturator foramen is going to be formed by all of the following bones except pubis,
Yes.
ischium,
No.
ilium,
Yes.
ischium, yes, ilium,
Yes.
no. Ilium is coming and continue until to my hand, to this plan. Inferiorly, the pubis and ischium only are going to participate to form the obturator foramen. What about the acetabulum? Yes. Ilium, pubis, ischium. All these three portions, all these three segments are going to participate to form the acetabulum. Now I rotate the hip bone to be able to show you the another view. In this medial view of the hip bone, I am able to show you 5 margin, 5 border. You know some of them, such as the superior border that we call iliac crest, posterior border that is too greater and lesser sciatic notch are a landmark, the inferior border and the anterior border. But we know the hip bone consists of 5 borders. Where is the 5th border? Here. The 5th border is visible in medial view. Which segment of the hip bone are going to form the medial border? The pubis and the ilium. The pubis and the ilium. In the exam, it is possible I ask you, for example, in medial border of the hip bone, which of the following bones are going to participate? You should remember the ilium and the pubis. Now you answer to this question. The pubis is going to form all of the or inferior segment except. What about the inferior border? Pubis.
Yes.
Medial border,
Yes.
anterior border,
Yes.
posterior border,
No.
superior border. So please look at the picture to get in your mind. This picture is going to help you to remember everything. Look at the medial border of the ilium. In medial view of the ilium, I am able to show you medial border. The proximal part of this medial border belongs to the ilium and has a special name we call arcuate line. This part of the medial border is going to be formed by the ilium and we call the arcuate line. So this portion we call arcuate line. It is possible also the arcuate line is going to belong to which of the following segment or following bone? Which bone? Ilium. Now look at the medial view of the ilium. In medial view of the ilium, I am able to show you the iliac fossa. This iliac fossa is a large and big fossa that it is going to cover and a muscle is going to attach here that we call the iliacus. Do you remember iliacus? Iliacus is a muscle that attached to the iliac fossa. And the iliac fossa, this area is larger in one race in the men compared to the female. So in the male compared to the female, the area, the wide area of the, or the concave area of the iliac fossa in the male is bigger and larger and wider compared to the female. Another surface in the medial view of the ilium is visible here. We call sacroiliac. We call sacroiliac surface. Sacropelvic surface. This sacropelvic surface is visible here. You know, until here, superior to this plan, the ilium is visible. So the arcuate line, the sacropelvic, is going to be found, and these two are going to be found inside of the medial view of the ilium. In the sacropelvic area, in the sacropelvic surface, we can explain 3 areas. Pelvic, here is the auricular surface, and here is the iliac tuberosity. So iliac tuberosity, auricular surface, it is an articular surface, and the form and the shape is auricular. And this small area belongs to the pelvic. Which pelvic cavity? A small pelvic cavity. So we can call sacropelvic surface or sacropelvic area. We go to the previous slide. In this slide, you are going to look at to the hip bone from lateral. So the lateral surface of the ilium is visible here. You know this lateral surface. What's the name of this surface? Gluteal surface. You remember in the lower limb you read about the gluteal surface. Which muscles are going to attach here? Gluteus maximus, medius, minimus. They are going to attach to lateral surface of the ilium. In the lateral surface of the ilium, if you remember, you are able to find three lines. The posterior gluteal line, the anterior gluteal line, the inferior gluteal line. Which of them is longer? Anterior gluteal line is longer. And with these three lines, the gluteal surface are going or is going to divide to four areas. Here, this area of the gluteal surface, posterior to posterior gluteal line, is the area for attachment of which muscle? Gluteus maximus. This area is going to be found between these two lines. What's the name of these two lines? Posterior and anterior gluteal line. Which muscle is going to attach here?
Gluteus medius.
Medius, gluteus medius. And this space between the anterior gluteal line and inferior gluteal line, the gluteus minimus. And this area exactly inferior to inferior gluteal line and superior to acetariolum. This area is a site for attachment of the capsule of the hip joint. Yes? And also some of the muscle in the lower limb, you read that they have some attachment to this area. Now I am coming down to be able to speak and explain for you the ischium. This is the ischium, such as a L. Ischium is such as the L in Latin. It is the ischium. The vertical part we call body. The horizontal part we call ramus. The ischial ramus, the body of the ischium. In this picture, you are going to look at to the body of the ischium. This is the vertical position and consists of three borders: anterior border, lateral border, and posterior border. If you notice to the posterior border of the body of the ischium, the posterior border of the body superiorly is going to be continued posterior border of the ilium. In the posterior border of the body, I am able to show you a spine. What's the name of this spine?
Spine of ischium.
Ischial spine. And exactly, immediately, inferior to ischial spine, you are able to find the lesser sciatic notch. If you notice to the body, in the body, you have three lines and three border and three surface. Femoral surface or anterior surface. And here you are going to find the ischial tuberosity. The ischial tuberosity is going to be found in between which border of the body of the ischium?
Between the posterior and anterior.
No. Look at the picture. Between the posterior and lateral. Between the posterior and lateral here, I am able to show you the ischial tuberosity. Ischial tuberosity here, if you remember, the hamstring muscle. Where is the hamstring muscle? Posterior of the thigh. In the femur, posterior of the femur, you have three muscles. You remember, we call hamstring. All the muscles that we call the hamstring are going to attach to ischial tuberosity. Now, it is the femoral or anterior surface. Here is the ischial tuberosity. And also, I am able to show you in medial surface, I am able to show you the another surface. This surface, medial to this ischium body or vertical part, is visible here. In the reproductive system, when we are going to speak about the prenatal, when we are going to speak about the ischio-anal fossa or ischiorectal fossa, we are going to speak about this surface. This surface of the body in the ischium is going to form the lateral wall of the ischio-anal space. Ischio-anal space laterally is going to be formed by this surface of the ischium. Look at to the ramus of the ischium. Ramus of the ischium is going to join, it is going to fuse with the inferior ramus of the pubis and make the ischiopubic ramus. Ischiopubic ramus is going to be formed by the inferior ramus of the pubis and the ischial ramus. They join or they fuse with each other and make the inferior border of the hip bone. Do we get everything? Do you have any question?
No.
Okay. So all the things you know, only I am going to repeat to help to you to remember. Okay?
Can you please repeat the ramus? It is formed by
Ramus.
ischial
Ramus of the
and-
ischium. Ischium has only one ramus. Here, the horizontal part we call the ischial ramus. This ischial ramus is going to be continued, it is going to fuse to the inferior ramus of the pubis and make the ischiopubic ramus. Ischiopubic ramus is going to form for us the inferior border of the hip bone. Now look at to the anterior and inferior segment. Anterior and inferior segment. This part we call pubis. We call pubis. Pubis consists of a body and two ramus. Superior ramus, inferior ramus. So the pubis consists of a body and two ramus. Superior ramus and inferior ramus. The body of the pubis consists of three surfaces. Anterior surface. This anterior surface is a place, an area for attachment of some of the muscle. It's in double. I'm not going to explain again the lower limb muscle. Only you know that the anterior surface of the body in the pubis is an area for attachment of some of the muscle that you read in lower limb is okay, is enough. The posterior surface is posteriorly. The posterior surface is going to form for us the anterior wall of the pelvic cavity. Are you agree? The posterior surface of the pubis is going to form for us the anterior wall, anterior surface of the pelvic cavity. Which organ exactly is going to be found posterior to the body of the pubis?
Bladder?
Urinary bladder in both sexes. In both sexes, male and female, the anterior organ in the pelvic cavity is urinary bladder. So exactly posterior to the body of the pubis, we are able to show you the urinary bladder. Between the urinary bladder and posterior surface of the body of the pubis, you have a very small area, small space. So the anterior surface, posterior surface, and medial surface. If you imagine, here we have the pubis, and here is the interpubic disc. This is the symphysis pubis, okay? And here is the operculum foramen. It is anterior surface of the body, posterior surface, and here is the medial surface. The medial surface of the body of the both sides of the pubis are going to form and participate in this joint. What's the name of this joint?
Symphysis.
Symphysis pubis. So the body of the pubis consists of three surfaces: anterior surface, medial surface, and posterior surface. The another name of the posterior surface we can call pelvic surface. Okay? You can call pelvic surface. Now, if we notice to the body superior to the body, I am able to show you pubic crest, and lateral to pubic crest, I am able to show you a tubercle. Tubercle. Do you remember the inguinal ligament? Inguinal ligament, in the lateral side, it is going to attach to anterior superior iliac spine, and medially it is going to connect to pubic tubercle. Pubic tubercle is going to define superior to the pubis body, and medial to the pubic tubercle, I am able to show you the pubic crest. Okay? So the pubic crest and the pubic tubercle. Now, about the superior rami of the pubis. Look at the superior rami. The superior rami is going superiorly, laterally, and it is going to go inside of the acetabulum to be able to attach to the ilium and the ischium. This superior rami of the pubis consists of three borders. This superior rami of the pubis consists of three borders: the inferior border, the anterior border, and the superior border. So the superior rami has three borders: superior border, anterior border, inferior border. Another name of the anterior border we can call the obturator crest. Obturator crest is another name of anterior border. The superior border has another name we can call pectineal line. We remember pectineal line. Some of the ligament in inguinal ligament. Okay? They are going to attach and continue to this pectineal line. So, if I want to show you the pectineal line here, the pubic tubercle is here, medial to pubic tubercle you have pubic crest, and lateral to pubic crest you can find the pectineal line. So it is the pectineal line, it is the pubic crest, and it is the pubic tubercle, and here is the pubic crest. Now, answer to this question. The pectineal line is going to define medial to pubic tubercle. Is it correct? No. The pubic crest is going to define medial to the pubic tubercle. Yes, the pubic tubercle is between the pubic crest and the pectineal line. So the anterior border of the superior rami of the pubis we can call pectineal line. The superior border we can call the pectineal line. The anterior border we can call obturator crest, and the inferior border is visible here. Between these three borders, I'm able to explain three surfaces. One of the surfaces is here. This surface we can call obturator surface. This obturator surface is an area for passing the neurovascular of the obturator. The neurovascular of the obturator are passing through this foramen, and they are going near and passing here. We call the obturator area. A triangle area remain. A triangle area remain here. Between which border? Superior border and anterior border. Between the obturator crest and pectineal line. This triangle surface, this triangle area we call pectineal area, pectineal surface. The pectineus muscle attached here. Again, I am going to repeat. The pubis consists of a body and two rungs. This body and these two rungs. Imagine here is the body and here is the two rungs. The superior ramus and the inferior ramus and the body. About the body, I told you, has three surfaces, anterior, medial, and posterior. The body has the tubercle, and medial to the tubercle, you are able to find the pubic crest. The pubis, the superior ramus, has three borders. Superior border or pectoral line, anterior border or obturator crest, and the inferior border. The superior ramus consists of three surfaces. This surface we can call obturator surface because the neurovascular of the obturator are passing here. This surface is triangular between the obturator crest and pectoral line. We call the pectineus surface. The pectineus muscle attached here. Another surface remains between which border?
Can you please repeat your question?
Superior ramus has three borders and three surfaces. You know the three borders and two surfaces I explained for you. One of the surface is here, one of the surface is here. Another surface is at the back. Between which border?
Between superior.
and inferior. We can call pelvic surface of the superior border. In male sex, the posterior surface of the superior ramus in the male sex has relation, is adjacent, is near to the spermatic cord. What is homolog to a spermatic cord in the female sex? Round ligament. So in the female sex, the round ligament of the uterus is passing immediately posterior surface of the superior ramus. In the male sex, the spermatic cord is passing. Means, if you have any fracture here, in the male sex, which structure is possible to get injury? Spermatic cord. In the female sex, round ligament. So please get in your mind, the superior ramus of the pubis, the superior ramus posteriorly is near to the spermatic cord in the male sex, and it is near to the round ligament in the female sex. And after the inferior ramus, you can have 10 or 15 minutes break. You can hear the inferior ramus is visible here. It is easy. Two surfaces here and posteriorly, and two border. Medial border, lateral border. Anterior surface and posterior surface. The anterior surface is a broad surface, and some of the muscles are going to attach here. The lateral border is a sign for attachment of this membrane. The medial border in both sides are going to form for us the infrapubic angle. Do you remember the infrapubic angle is difference between the male and the female sex? What is difference? Yes.
Wider.
In the male sex and female sex. In female sex, this infrapubic angle is larger, wider compared to the male sex. So the infrapubic angle is going to be found inferior to symphysis pubis, and in each side, the medial border of the inferior ramus of the pubis are going to participate. In the male sex, it is 50 to 60 degrees. In the female sex, it is 80 to 90.